All right. So good afternoon. Welcome to Ahead of the Curve, a speaker series from the University of Michigan School of Public Health. My name is DuBois Bowman, and I have the privilege of serving as Dean of the school. This is a very special edition of Ahead of the Curve because we're hosting it in partnership with the Griffith Leadership Center, which is located in the Department of Health Management and Policy at the school. The Ahead of the Curve speaker series focuses on conversations about leadership. Throughout this series, we have discussions with contemporary leaders to hear about their insights, their vision, and their stories of perseverance. So it was natural for us to partner with the GLC on this event. We have a fantastic guest with us today, Amir Dan Rubin. So welcome, Amir. If you've joined us for Ahead of the Curve events in the past, the format today is going to be slightly different. After my remarks, Amir will be invited to the stage to be able to give a keynote address. And then following his keynote address, Amir and I will engage in a conversation that is intended to dive just a bit deeper into his leadership journey and experience. Amir has focused his career on helping to transform healthcare. He currently serves as CEO and founding managing partner of Healthier Capital, a venture capital firm focused on healthcare innovation. He previously served as chair and CEO of the technology-enabled primary care company One Medical, which he took public in 2020 and then sold to Amazon in the beginning of 2023. At Amazon, he launched the offering of One Medical membership as an add-on to the Prime membership. And prior to that, Amir held numerous leadership positions in the healthcare arena. And so, Amir, I'm delighted to have you here today, and we'll turn it over to you to offer your remarks.
Thank you so much, Dean Bowman. Amazing to be here at the University of Michigan, at the School of Public Health, at the Department of Health Management and Policy, the Griffith Leadership Center Biennial Institute. Incredible to remember and memorialize Jay Warden, who was a good colleague and friend of mine and an incredible leader, and also to celebrate Gail Warden with his incredible leadership and commitment. So it's an absolute honor to be here in person and to be here on Ahead of the Curve. DuBois is a biostatistician. I kept thinking area under the curve the whole time, so I was boning up on my statistics here. And what I thought I'd do is talk a little bit about health tech models ahead of the curve. And so as we think about innovation in healthcare, one of the exciting areas is how do we apply this new and exciting technology that we're seeing, AI, software, with the problem statements that we face in healthcare? And I'll try to do this from the lens now of my seat at Healthier Capital, kind of looking at startups and investing in startups. And then maybe I'll show some examples from my experience at One Medical. And then we'll close and talk a little bit about what do we look for with successful, innovative companies that are blending kind of these problem statements in healthcare with technology. And maybe to kick it off, we're all very mission-driven here in healthcare, and certainly at the University of Michigan. So even as a venture capitalist at a company called Healthier Capital, we have a mission statement, which is to advance healthier outcomes for all. And we take that really seriously, and we're excited about the opportunity to do that with innovative companies and entrepreneurs. I often like to start with the problem statements in healthcare, and I often go to the stakeholders in healthcare. And on one side of this, if you will, the left side to the audience in the room, or is the demand side. And if we look at the demand side, consumers are in general frustrated with access and service experience and wait times. Employers and payers, whether they're commercial payers or governmental payers, are frustrated with costs of healthcare and waste. But it's not just the demand side that's frustrated. Many of us in the room work on the supply side of healthcare. We see huge levels of burnout in clinicians, physicians, nurses. We see shortages in workforce, and we're seeing these problems globally. And then as we think about coordinating care and building health networks of care, that's even becoming more complex. We have a rapidly aging populations. Our baby boomers are busting. We're going from 54 million people over 65 in 2019 to 73 million people forecasted by 2030, so in a very quick amount of time. And we're seeing health systems, health plans, health networks wanting to better coordinate care. And so from a health tech venture perspective, we're excited about innovators who can take these problem statements, look at these stakeholders, and apply technology to that. And I often like to say, we're looking for solutions that are not zero-sum solutions. So if you delight the consumer, but annoy the doctor, not great. If the insurance company hates it, but the consumer loves it, hard to do. So often in thinking about these innovative models, it's how do we look at the multiple stakeholders. I put up here on the slides just a few examples for some of the companies that we're involved with on the demand side. For consumers, this company called Ezra that has an FDA-cleared AI software that can do an MRI in half the time. Increase throughput, increase revenue, reduce time in the scanner. Or as we think about value-based care, care value, and clinical services innovation, this is a company, My Health, and serious mental illness. Serious mental illness, think patients admitted with schizophrenia, psychosis, multiple hospitalizations per year. Typical 30-day readmission rates in this population is about 25%. MI is close to zero. And so payback, if you go to talk to a health plan, is next month, one of the 4 patients won't get readmitted. That could be tens of thousands of dollars. So those are examples on innovation, if you will, on the demand side. If we think about the supply side, this is a company we've been talking to, Hyro, that's in a number of health systems right now, maybe some of them in the room. They're at Intermountain, Hackensack, Hartford, and a few others. Oh, a few out here, so we can have some testimonials. And this is using agentic AI agents to automate contact center communications. And at some of these contact centers, 85% of the workflows are being automated. And you can do full voice, conversation, messaging. And the nice thing about these AI tools now, you have to watch for safety, make sure data doesn't get sucked up out of the organization, and it doesn't just make up answers, but also how do you integrate into your EHRs, Epic, Cerner, Athena? How do you integrate into your phone systems, NICE, Avaya, Amazon Connect? And so thinking about these integrations is really important. Or also as we think about software and tech-enabled services to better coordinate care. This is a company, Metaloop, that's automating clinical research. So for example, actually for the biostatisticians in the room, researchers can take EHR data, normalize that with outside data, and then write queries in natural language. And basically the system is doing kind of autonomous research. So if you'll say, hey, what's the correlation between C-reactive protein and lung cancer? It's running on these GPU chips. And it'll say, well, to answer that, let me set up a control group. And I will look for data for people with elevated C-reactive protein that don't have lung cancer. And then I'll use an experimental group with patients who do have both of those. By the way, I ran this, I saw these outliers. It automatically pulls out those outliers. I'll then do a two-sided t-test. Is that the kind of statistics I should be using, DuBois? And it does this automatically in minutes. And so we'll still need great biostatisticians, of course, but this can automate a lot of the work of kind of getting data, normalizing questions, and getting a lot quicker to these questions that we want to answer. So these are kind of examples of the problem statements and innovative companies that are looking at these, at solving some of these problems. Now, when you look in the startup world, one of the things, we had an amazing panel here of amazing innovators. All the panels have been amazing, and I heard this from a lot of the other speakers as well. They often understand where the margin pools are. And so we can't be naive in healthcare where the margin pools are. And this chart shows on the bottom EBITDA, earnings before interest, taxes, depreciation, amortization, so kind of cash flow approximations. And the coloring is growth rate over the next few years. So you see on the bottom, payers have about 78 billion in EBITDA, providers 385 million. This whole area, services and tech, 100 billion in EBITDA. And if you go back 5-10 years, this was not this. So this is this kind of growing area. You see pharmacy services, 86 billion. You see 47 billion of that in specialty pharmacy. We could have a whole conversation just on that and the excitement and challenges there. And then you see on the pharma and med product side. And then as we dig into kind of the health tech opportunities, we see high opportunities in software platforms, data and analytics, business and management services, payment services, clinical services, the kind of areas I just showed some example that technology can really help us automate and hopefully address all the stakeholder needs. And then if we look in the first 6 months of the year, where have investments been happening in the health tech space, on the left-hand side of this chart, you see treatment of disease, non-clinical workflow, R&D, clinical workflow, on-demand healthcare, and clinical decision support and precision medicine. And when you look at top clinical conditions, probably not too surprising, you see mental health, cardiovascular, oncology, weight management, reproductive and maternal, and neurology. So these are kind of areas where dollars are going into, problem statements that startups and investors are looking to address. Let me now quickly turn to some of the factors, at least when I'm looking at interesting startups, what we're looking for. And it starts with this kind of looking at the multiple stakeholders. And as somebody said in one of the other panels, do they solve a problem that anybody cares about? And are they differentiated in that? Let's say you do that. Then distribution matters. Many of you are actually buyers, health systems, health plan leaders. It's really hard to get to talk to you and your teams. And so how do you get those sales? How do you keep those sales? So customer acquisition, retention. If you manage to do those things, then is there a margin in it? And is the market big enough? Everybody's like, oh, we spend, close to 20% of the GDP in the US, about 11% of GDP globally on healthcare. That's a big market. But what about the widget you're selling? So that's an important thing we look at. And then how does this grow? And how do you finance that growth? And then can one execute? You could do all those other things, and many of us work here in the execution side of healthcare. It's really hard to execute on healthcare. You could do everything conceptually right, but execution cannot be assumed. That's why you need a degree from the Department of Health Management Policy or the School of Public Health at the University of Michigan. You could do it all. And so what I thought I'd do is use my experience at One Medical as a little bit of an example. We did a lot of things right and many things not right, but an example of some of these factors and how we thought to think through these things. One Medical is a modernized doctor's office in primary care that combined a membership subscription for all-you-can-eat digital health, no copay, no deductible, no claim, answers in minutes, with in-person locations, longer appointments, easy access, half-an-hour appointments, salaried providers. Think about concierge care that takes your insurance and charges $9 a month. That's in a nutshell. And so first was that product market fit. What did people want? And actually, I go back to my HMP education. Penchansky and Thomas talked about the 5 A's of access, and I actually use the 5 A's of access for those students who haven't done that yet in their 600 course. You'll probably get to that. But this is, when we think about the problem statements of consumers, one of the biggest problems is access and all aspects of that. Is it accessible? Does it accommodate me? Is it affordable? And those are the things we actually thought through at One Medical. So convenient locations in non-medical places, easy to get to, digital health with no copay, no deductible, no claim, and essentially no wait. And what we saw is we drove up dramatically, kind of 3 to 4 to 5x the use of primary care. And later on, I'll show you, drove down use of specialty care. We also built our own software, our own electronic health record. And one of the things that we found, we have with our, what we call members, 45% of the members engage with us every month. So pretty high every other month engagement. And some of that can be outbound digital population health. It's time for screening, mammogram. Let's check on your blood sugar. And also we thought about multimodal care and the design. People talked about user-centered design and lean thinking in some of the other sessions. These are very much permeate how we had thought of things. And then we started growing into seniors and into dual eligibles. We actually acquired a company that was taking full capitated risk, but similar model, salary model, built for purpose primary care, but a much more clinically complex population. So we had to adapt some of the services, including we would go into the home for our most complex patients. And then team, very important. All of our team, our clinicians, physicians, nurse practitioners, and others, straight salary. No productivity bonuses, no quality bonuses, no service bonuses. Now, we measured all of that. We're like, we just have to do it. But we decided we wanted not to do that, but we wanted to just have that be the way that we practice. And we thought about multiple stakeholders. So we were able to deliver 90 net promoter scores and 90 percentile on HEDIS scores for our consumers. We were able to show we can get easy access for employees, and we've shown for payers we can reduce the cost of care. We'll talk more about that. And on the supply side, 100% salaried model. And with our technology, we showed we had about 58% less tasks, less work, less burdens of desktop medicine, if you will, than clinicians would have in other electronic health records. So for example, we have all this unlimited 24/7 communication. When those messages come in, we use natural language processing. Now we're using generative AI that read all those messages, depending on the context or content, pulled that message out of the in-office provider's inbox. We had a 24/7 team, 24/7 worked across the country, licenses in every state, that would then respond to those. Now we have a generative AI answer with a human in the loop to automate that. So blending technology to address the consumer needs and the clinician needs. And then we took insurance, we integrated with the Epics and Cerners and Amazons and Walgreens and CVS's and LabCorps and Quest, so we could own that complexity on behalf of the patient. So one click does it all, and sometimes it was more than one click, but that was the intent. How do you own that complexity on behalf of both the consumer and the provider? Distribution and customer acquisition and customer retention really matter. For One Medical, really how we really started growing is we went to employers. We said, hey, would you offer this benefit to your employees and your dependents? And we signed up thousands of companies. And we said, we take your insurance. And so we tried to make it easy to distribute. And then we started having to show and demonstrate that we could deliver results for them. This was a nice paper we had in JAMA Network Open a couple years ago. For one employer, we took down their cost 45%, not bend the cost curve, took it down almost in half. And we saw 26% reductions in prescriptions, and you see 33% reduction in ER, 40 plus in surgery, and 50 plus in specialty. Again, thinking about those 5/8 of access, making the most effective thing, the easiest thing for the user to do. So it wasn't about financial incentives here so much as customer service. It was so easy, so quick. Why wouldn't you go to this first? And that ended up helping us save money. We also showed that we had 2x the results in reducing hemoglobin A1C from others in publications, and had a nice paper published on that as well. And then on our Medicare Advantage and ACO REACH, this is data from 2023. We were basically ranked number 1 or 2 in the highest performance in saving the most amount of money in those programs on complex Medicare and dual eligible populations. So thinking about distribution, and distribution is different in commercial insurance versus Medicare versus Medicaid versus dual eligibles. Then think about economic models. And similarly here, when we went to employers or the commercial side, our economic model was small membership fee plus either a capitation or taking insurance. In the Medicare Advantage side, it was taking full global risk and hoping we can manage that cost down for each cohort over time. So you had excess dollars that you can redistribute to go to people's home or have more intensive care, or we had behavioral health in all our primary care clinics. And then in thinking about growth, thinking about how we can grow in existing markets and new service lines. And then you have to think about how you can finance growth. We ended up growing to a lot of physical geographies across the US. But then we needed to think about how we finance growth. So we moved from raising money privately from venture capital, and then decided it would be more effective to raise in the public markets. So we raised on the stock exchange. And then really to pursue our further growth, We were growing B2B, business to business, selling these employers, but business to consumer would be a great way to grow. And I'm like, I wonder who has a bigger membership program than One Medical. I'm like, as I'm ordering my supplies to my house, Prime. So we started talking to Prime and we said, what if you added this to Prime? And they said, we'd like to do this, but we'll need to own you. I'm like, oh. So we joined with Amazon, and I stayed a year there. In 2023, we launched on Prime. So if you're not One Medical members, it's $9 a month, $6 for every additional member of your household. And that's been an exciting opportunity to reach more and more people in the US and potentially beyond. And Prime now offers One Medical. And so finally, execution and team matter. I often think about 3 components to an operating system. And now I have the healthier operating system, HOPS. This was actually, I called it the organizational performance system, but we called it the One Medical performance system, TOPS. And those 3 components kind of built off of tenets of lean and design thinking. Strategic alignment and deployment. How do we align our teams on goals and cascade those through up and down and sideways throughout the organization? Improvement and innovation, and maybe most importantly, active daily management. What do we do each and every day, always? And I know a lot of the leaders in this room use a lot of these techniques. Do we round? Do we huddle? Do we have standard work? Do we have continuous learning and training? How do we measure? Do we go see for ourselves? And these are key components of TOPS, and CI Care is an instance of that in customer service experience, which we've used throughout my career at UCLA and Stanford and Optum, and at One Medical, and now at Healthier Capital. Yes, we have a service standard at a venture capital firm. All of us are trained in CI Care. How do we connect, introduce, communicate, ask, respond, and exit? We strive for 10 at Healthier Capital, 10 out of 10. And then team matters. I've had the privilege of working with incredible colleagues and team members, many University of Michigan. Actually, one of my colleagues there, Jose, is another great U of M grad that works with us as well. And hopefully you can then delight people. And people were saying, I can't imagine life before having One Medical. That's quite something, like that one. Service is amazing. It's one of the best benefits at my employer. It was a game changer for us. So in closing, those are some of the things that we think about as key factors in health tech models ahead of the curve. Thinking about those stakeholders and product market fit, thinking about distribution and how do you acquire and retain customers, thinking about the economic model and the market size, and then thinking about how do you grow, but how do you finance that grow? And ultimately, what are the systems we use for execution? So I appreciate the opportunity to share some of this with you, and I'm excited to engage with Dean Bowman ahead of the curve. Thank you.
So can everyone hear me in the back? All right, perfect. So thank you so much, Amir, for really your insights into a rapidly changing healthcare market. This is a special moment for me as well. We launched Ahead of the Curve back in 2020, and immediately upon developing the concept, I thought of Amir. And so this is a moment that I've been waiting for, to be able to host Amir on Ahead of the Curve. And so what we're going to do now, again, is to really just try to delve a bit deeper just into some of your experiences along the way. And I want to start really at the beginning in thinking about your time at Michigan Public Health. And most of you know that Amir earned his MHSA at Michigan Public Health. His wife, Nicole, earned her degree at Michigan Public Health as well. And as I understand, they met at orientation. And so we have some students with us here today. I hope that our students are able to see you not only as an inspiring model, but that they're also able to see some of themselves in you, in the future, in their careers. And so I want to just ask you, if you reflect back to your time in Michigan Public Health, if you will maybe comment on classes, experiences, people who were especially formative to you during that time?
Yeah. Well, first comment is, don't skip that pizza party on the lawn of SPH1 because you may meet your significant other. So that actually was the first day. And then I saw Nicole again in the bookstore. So we like to say our origin story together is Pizza Party Bookstore. So, gosh, there's so many incredible people that were big influencers, so many incredible faculty members and peers, having Dr. Mike Chernu back here, who we had for econ, and Rich Hirth and Rich Lichtenstein back here, and of course, Professor Griffith, and so many incredible faculty and incredible peers. It's so fun seeing so many of our colleagues here, and we are really connected, this Michigan, I don't know what's the nice word that we're saying, the Michigan family. But it's an incredible group of people. We were very energized to transform healthcare, very collaborative group. So many of those experiences were really seminal. And coming back here, we still have the cinder blocks of SPH1. I know the campaign is launched. Hopefully we'll do something with the cinder blocks eventually. But they've managed the test of time, I guess. But it's incredible. And just incredible, the history here of the people and what's been done, across health management and policy, HBHE, epidemiology, biostatistics, and cross-departmentally and across the university. So we took advantage of all of that. And having the School of Public Health and the Department of Health Management and Policy within the University of Michigan, I think, is also an incredible advantage.
Yeah, thank you for those comments. We are trying to do something about the cinder blocks, just so everyone knows. And your comments really just about the Michigan public health family and network. It's real. It's something when I talk to our students about, I share when I talk to prospective students, and but it's nothing like being on the inside and being a part of it and seeing it work and seeing it play out in real time. And Amir, I know that you play an active role in doing so. So I really appreciate your efforts there. So the next question I'd like to ask, the field of healthcare is evolving very rapidly. And when we train, we're training our students not just for entering the workforce at present, but really foundational skills that they'll be able to draw upon for years to come. And so thinking about our students today, what are some of the skills that you think are important for them to develop and focus on during their training if they want to contribute to the field as cutting edge leaders?
Well, first of all, it's been amazing interacting with the students. What an incredible group of enthusiastic, smart go-getters. So I think the students are off to a good start. I think a few things. First of all, be passionate about what you're doing and be prepared to work very hard and to get after it and go get it. You got to go get it. Like, you have to get after it. And I know Michigan students do that. One has to persevere quite a bit in healthcare, and we have so many healthcare leaders here will attest to it. It's almost an impossible industry to be in management, right? It's just like you have state and federal policies, you have multiple missions, you might have research, education, patient care, you have pandemics thrown at you. Like, is there anything more challenging than like having to run an organization of healthcare providers in the middle of a pandemic when you have no idea really what's happening? So you have to be very mission driven, I think ethical, values driven, but also perseverant and be action oriented. And so I think those are traits that I've certainly seen in my colleagues here and across U of M and certainly in the student body and other great healthcare organizations. I think, as one of our faculty members said earlier on a panel, you have to learn to continuously learn. Some of the things I was talking about in my talk on AI, I mean, they didn't exist a year ago, like just not on the planet, right? And like within a year. So you have to learn how to keep learning, keep being inquisitive. I think having a combination of analytic skills, being facile with technology, having great communication skills, having a little bit of chutzpah and gumption to get in there, stir that in a pot, I think are some of the traits that I see in our student body, and I think will serve them well.
Absolutely. And the intellectual curiosity and agility, those have always been important, but no more important than now, just as rapidly as things are evolving. So you shared, and we discussed a little bit just about various steps, fairly recent steps in your journey. I want to go back and kind of peel some of those apart and inquire about them. And so again, just as a recap, you became CEO of One Medical in 2017, which at the time was a venture capital-backed private company, which then went public in an IPO in 2020. And then One Medical was acquired, as you noted, subsequently by Amazon, and that was in 2023. And so in a very short time frame, that's really, really, really significant change. And so I want to start really in the early phases of, you had this concept and a vision of a new model. And can you talk us through your vision for the company as you began your tenure as CEO?
Well, I really think actually the things we were doing at One Medical are kind of common knowledge to people. The question is back on those different aspects of successful models. Can you get product market fit? Can you get anybody to buy it? Can you find a way to distribute it? Can you find an economic model to make it work? And can you finance it? And actually, when I was CEO at Stanford University's health system, we had built a salaried model primary care group. We were actually the first to do video visits on Epic. This was 15 years ago. There was no APIs. We hacked it. We were the first to build an app on it. Very hard to do, however, ultimately in a tertiary academic medical center as a model. And so it's like, okay, these are concepts. These are not unknown concepts. Do we think we could build a model that can stand on its own? And so the concepts I don't think are that novel. And hey, what if you give people what they want? They want nice people to talk to them really quickly, 24/7 on demand, and they don't want to have to pay at the margin. It has to come somewhere. So that's kind of there. And so we're like, okay, well, what if we charge them a little bit up front? And what if we could do it asynchronously? And what if we could use AI to automate that? And so we could take the cost down. What if in the office we didn't have medical assistants, which we don't? The physician or clinician will greet the patient. What if the clinician then walked the patient back? They did all the vitals themselves. What if then they walked the patient back up, went and cleaned the room and saw the next patient, but had no nights, no weekends, no calls, salaried model, and 30-minute appointment? Would they take that trade-off? And so these were kind of the things that we were working on. These were the hypotheses, but I don't think they were per se novel or unique to us. It was, how do we put these together in an economic model, in an execution model that then we could scale. We scaled to 31 markets physically and digital health across the country. And sometimes, as I mentioned in the remarks, the execution is really hard. Can you run a 90 net promoter score in a 1 minute wait 24/7 in multiple states and cities? And that you can't just lean startup, just roll up your sleeves and do it. You have to build consistent tech and ops and systems and team. And then we went from hundreds of people to thousands of people and hiring doctors and clinicians across markets. So that became then, I'll call it an execution challenge.
If I can really dig in right there, right? So you had the early days where you were very successful and really established proof of concept, right? You knew you could do it. You knew the model would work. And so then there was opportunity to scale. And scaling is not without risk, right? And so how did you scale the company in a way that was sustainable and didn't overwhelm the operations with growth that was too rapid?
Yeah. Well, I'll say I didn't overwhelm the operations. You might ask some other people in the teams and say, well, because you're kind of going at breakneck speed. So, but I think it starts with having an operating system and a way we do things. And so otherwise one can't, I don't believe, scale in a sustainable way. You can hire great talent, but if you're like, hey, go figure it out. So we tried to have, our operating system, the One Medical way we do things. And that's from everything from how we interview, what are the questions, what's the process, what do we do when you onboard, what are the kind of things. For example, we'd interview physicians and we'd say, would you mind sitting at the front desk at a moment and just answering some phone calls? We don't want you to do that, but would you do it? Do it during the interview. It's like, get interesting. I mean, we had these different little approaches, techniques, things we would do. Again, but these were by design. We had 3 types of physical design. It used to take us 3 months from construction to go live. We got that down to 1 day, so kind of real lean processes, everything from supply and setup to furniture and everything and the like, to how do we train on our clinical protocols and practices. We had medical advisory councils. We had different sub-councils, whether it was LGBTQ care or BIPOC care or mental health, and we had clinical experts, but everybody would be in weekly rounds, and then we would train, we would standardize. We had our own kind of tenure process. We called it the Star Provider Program. So you'd actually have monthly exams. We'd give them case studies, and then over a few years, if one performed well there and your metrics were good, you were promoted. We didn't have incentives kind of on a daily basis, but it was kind of an up or out. And if you did, you went up. And so those were some of this, but they were processes and systems that we scaled.
Yeah, that's fascinating. And often we hear criticism of tenure. And so it's nice to see that similar concepts adopted in the
There was no
arena.
guaranteed tenure, however. They just got to the next stage. But really, we wanted everybody to succeed. And so part of that is this the right fit? It might not be the right fit. Not everybody may want to clean their exam room. It may not be the right thing for you, and that's okay. But this is how we're going to do it here.
Yeah, and another question I want to ask about during this period of rapid growth for the company, another thing that is significantly impacted is culture. And I wonder if you can just comment on how you went about that culture change journey, and whether there were the non-negotiables that had to be there, whether small or large, but the other inevitable parts of the culture that will shift in how you handle that in your leadership.
Well, a few things were certainly non-negotiable, and again, we tried to define these as much as we can, and we improved them over time. We call them our DNA and our CI care, our service ethos and experience ethos. Those were non-negotiable. So we were going to treat each other with great courtesy and dignity and respect, and we were going to treat all of our interactions, all of our consumers that way, and we would all be trained and practice, and we'd go observe every week in the field how we were doing this, and we would measure at the individual level, and that was non-negotiable. And that's how you can sustain 90 net promoter scores across the country at scale with thousands of people. But I didn't come up with the standards, the team did. So we had our behavioralist came up with those standards, our pediatrician came up with them, like, what's a good experience? What do you tell somebody when they have a bad diagnosis? Is there best practices? Doesn't mean everybody's saying the exact same things. Let's role play, let's practice this. We had people who were more senior in their career who had a lot of experience and some that had less. So those kind of things. Our core DNA, we said human-centered and team-based and driven to excel and intellectually curious. And those were kind of the traits that we were looking at people. We wanted a very inclusive and welcoming environment as an organization. We were about 70% women, about 45% people of color on our team. That was really important as well. And we were looking for people that this is the culture and environment they wanted to be in. And again, it's not a right or a wrong culture, but it's the one we picked. And this is how we were going to do it. And if it's not a good fit, that's okay. But this is how we want to operate.
Terrific. So now I want to just ask you to reflect on maybe some leadership lessons learned along the way. Our students in the audience, some of them will be future CEOs. And for anyone in the audience who's interested in being a CEO, what are some of the best lessons that you've learned in your CEO positions?
Have a great and supportive family because these roles are all encompassing. And so you have to love it, and you have to believe in what you're doing, and you have to believe in the mission. I know so many people in this room, and I know how hard they work. It's 24/7. Dean's jobs aren't exactly easy these days, Dean Bowman, with all the challenges in universities. So you have to love it. You have to be driven. And you have to, as I said before, want to get after it. Is another panel what the entrepreneur said. You will get a lot of no's. I like to call them not yets in the entrepreneurial world. And they're just not ready for the yes. So one has to work hard, one has to persevere, one has to have support. And thus you have to balance that into your life in the sense of, I believe in this. This is part of who I am. I'm mission driven. So I think that's been an important part, and something that I've learned, I guess, or experienced over time. I like some of the tenets from Lean. An old CEO of Toyota, Fujio Sho, used to say, go see, ask why, and show respect. It's that's some good, simple advice, right? Be respectful, go see for yourself, but ask, why do we do it this way? And healthcare is so complicated, we often find that we don't exactly know why we're doing it this way. And actually, pretty much nobody knows the end-to-end process in healthcare. So get in there, try to understand it, and be connected to team members, but also customers. So, for example, I color code my calendar. Green were customers, whether those were patients or employers. If I don't have a lot of green on my calendar, if I'm not in the field, if I'm not in the sites, I know it's not going to be good over time. Need to have that balance. And you learn a lot by being out there, and you gain respect for the needs of patients and families or employers or whoever the clients might be, and certainly of the team and what they're facing on the ground. So those would be some takeaways I've had.
Great. So I want to ask you just for your thoughts. So you've been wildly successful at One Medical. You presented and commented on the problem statement to begin, and with your success, you lowered a lot of barriers to healthcare access, like the waiting many months to get an appointment, simplifying the process and allowing patients to be able to do many things from their cell phone. And so I wonder if you've seen changes in patient expectations, right? Whether or not there's a shift that will prompt other healthcare delivery systems to change, and perhaps some of that prompted not just by One Medical now as a precedent, but maybe even from the pandemic.
Yeah, well, certainly there's many amazing healthcare institutions and are working on these challenges. I think what we were able to do at One Medical is, at some level, just be very overt about it. The patient wants to talk to you now within a minute or two and doesn't want to pay. Is there a model to do that? And how would you monetize that? Well, maybe we could save downstream. Maybe that would involve specialist visits. And maybe there's some trade-offs. Well, maybe if we gave the provider more time, they wouldn't need to refer because they could deal with the diabetes and COPD and CHF and some mental health issues because they had the time. So some of it was designing models, both on the consumer side, but then how do you operationalize that? And some of that's really hard to do in existing organizations because you have existing technology, you have existing economic models. So sometimes this is why startups can be a good environment to do this. And again, many of them will fail. They're very risky. And when you take capitation, this is not huge insights to the many health plan leaders, but as I often said, risk is risky. You can lose your shirt. And so there's also reasons not to necessarily flip existing business models upside down in big, important community-based institutions. But this is where kind of I turn to technology, and I think we can automate a lot of the administrative and some of the clinical intake processes in both our kind of bigger, larger health systems, health plans, as well as in these kind of more startup organizations.
Terrific, terrific. So if we'll go now to the point where you're in communication with Amazon, and you told us a little bit about the driver of "we'll need to own you," but I want to just peel back and ask you about some of those early conversations, the rationale from your perspective, right? What did you think were some of the benefits and possibilities of having a partner like Amazon? And then, if you're comfortable, maybe even things that you're nervous about.
Yeah, well, I've always liked big mission statements. So at One Medical, it was to transform healthcare for all through a human-centered and technology-powered model. And I was like, well, Amazon's getting close to all. They're closer than One Medical was on its own. So that was kind of interesting. And there was a lot of, at some level, shared DNA. Obviously, they were way, way larger than us. But Amazon combines, if you will, logistics and tech. They have two divisions. They call one division stores. And we were in stores, which I kind of enjoyed. Like, we're in the store. And then tech, you think Amazon Web Services. Well, at some level, One Medical combined logistics and tech. We had clinics, stores, physical sites, and we were building software and tech. We both had membership subscription programs, and we both had really high obsessions with customers, and we both had focus on execution. And so at some level, they were really a great alignment in terms of what we were trying to do, and certainly Amazon's done this in unbelievable scale. And so that was exciting, but they had recognized that, healthcare is, as I like to say, idiosyncratic. Sometimes it sounds like idiotic and crazy, but I meant idiosyncratic, right? It's one has to understand all the different payers, and they would ask like the really, really thoughtful questions, and they had a lot of smart people, obviously. So that was a really nice fit. I think with anything, with any integration, one always wonders how that's going to work. But the nice thing is we were a clinical model. We weren't another fulfillment center being integrated into a larger fulfillment center. So our clinical experience has been great. It's continued to be great. It's grown dramatically. It's on the Amazon webpage. We're on the front of the Amazon webpage. We would have talk about cost of acquisition. That's nothing we could have ever afforded and thought of, and has brought us to new heights. So that's been really compelling.
Yeah. And I want to ask also about the role of data, right? That data is an important driver in the One Medical model, and Amazon certainly has lots of data. Did you see that as an opportunity to build on what One Medical was already doing at the time?
Absolutely, but, and let me say first the but, we were very, very deliberate. So the One Medical information is completely separated from Amazon information, and that's actually part of what took us a while to launch One Medical on Prime. Even the fact that you clicked on One Medical isn't known, and isn't known in the other parts of the organization. So we were very, very thoughtful, intentional about that. So there's amazing resources at Amazon, but we have to be very careful and thoughtful about how we do that. And now starting to leverage a lot of, not so much data per se, because we're trying to keep that distinct, but more, I'd say, kind of the AI capabilities and leveraging these large language models. And we happen to be hosted on AWS. I got even better pricing on AWS as being part of. They do charge us though internally. But that kind of resource, because we were also building our own software and technology, so leveraging that bigger team was remarkable, and the talents there were things that we just couldn't afford as a startup. So I'd say it's really more on the analytics and capability, certainly on the digital marketing. They had incredible capabilities, so we would we would do our own kind of A/B testing online, but they had teams and teams and teams of people who are expert on this. So that was super fun, leveraging that kind of capability and comparing what got more, activation, including in trying to get people to engage on their clinical care. So, what would activate people the most in terms of following up on your blood sugar or your high blood pressure or like, so leveraging those kind of insights and capabilities were pretty remarkable.
Terrific. And so now that moves into the present at Healthier Capital. And you gave some examples in your remarks of some of the kinds of things that you're working on, the excitement around AI. But what prompted you to move in that space? And then I'd like to just ask, what you hope to accomplish.
Yeah, I think what prompted me is I think now in retrospect, I kind of like the steep part of the curve. So maybe the steep part of the curve, I don't know if I've always been ahead of the curve, but I like the steep part of the curve. And so I'm pretty excited about how technology can intersect with healthcare now. And there's certainly a big place for large organizations to do that. But when the technology is this new, a lot of it is also being tried out first in this startup arena. And so that's where I wanted to turn my energies.
Terrific. And so there was a question from the audience at the time of registration. I hope the member is currently here. But I'd like to just ask, who provides advice to someone at your level, and what role do you believe that seeking guidance plays in success?
Yeah, well, if you're fortunate enough to marry a graduate from the Department of Health Management and Policy at the University of Michigan, you get a lot of great free consulting advice. And Nicole has got a distinguished career in her own right and is been a CEO and an executive and on a lot of boards. And so I will definitely talk with things with Nicole. So that's a great source. Also, as we were talking before about kind of thoughts for students, I consider myself a continuous student. And I don't know if this was a Rich Lichtenstein quote from 600. Rich was sitting over there somewhere, but you find out, you learn, maybe you said this a few decades ago, over time you learn more and more about less and less, and then you wake up and you realize I know everything about nothing, so continue to be humble. I certainly know a lot less than I thought I knew. Like even when I was younger, I was like, I got this. And now I'm like, I really didn't know much about that. And that's okay. One should dive in. So I'm continuously learning from everybody. I learned a lot at this session for sure. I learned a lot by going out in the field and talking to startups and team members and making rounds, talking to clinicians, researchers. There's incredible research. Faculty at Michigan and elsewhere. So I'm continuously looking to learn. And so, I don't think I necessarily know that much, but I think I'm curious and I enjoy learning and I want to keep learning and I love engaging with people on learning.
Terrific. So we're all very proud of you as an esteemed alum, but I want to also take some time just to make a few comments about the many ways that Amir and Nicole give back to the school. So last year, you and Nicole gave a transformational gift to establish the Rubin Department Chair of Health Management and Policy. In addition to this generous gift, you give of your time. And you serve on the Griffith Leadership Center Advisory Board. Nicole is a very engaged member of the school's Dean's Advisory Board. And again, today is the official launch of the university campaign, and you and Nicole don't have a lot of extra time on your hands, but you agreed to be a part of the national co-chairs for the university campaign. And then you commented in your remarks, I know that when we've spoken, you commented on how you like to look for opportunities to hire University of Michigan students, whether in internships or in permanent positions. And so just if you can share your thoughts on, what drives you to stay engaged and give back to the University of Michigan School of Public Health.
Well, I think the way to make significant change is through organizations. That's why I love management so much. And it's also really hard to make change, but organizations have a big lever. And you think about the University of Michigan at all levels, kind of the levers that it has to improve people's lives. Many people in the room might be even first generation going to college, but whatever people's backgrounds are, this is a transformational experience for individuals, for communities, hopefully for the world. In that SPH1, transformed, management of diseases, polio and otherwise, and we have so many leaders in the HMP program who have run and are running these incredible institutions. So an opportunity to engage with leaders and best on making change in the world and positive change in the world. And if you can do it with like-minded people, it's a great privilege to have that opportunity.
Terrific. We're nearing the end of time, and so I'll just offer an opportunity for you to provide any final remarks of advice to our audience, but especially our students in the room.
Don't take any advice you hear too much to heart. I think work hard, persevere, get after it. There's a lot of opportunities here. At some level, I felt like nothing's due to me, nothing's owed to me. You got to go out, you got to get it. If you want to make the impact, you want to do something, go get it. If you don't, that's fine. Your time here is short. It goes very, very fast. And then you find your time in your career and your professional life and your family life is very, very fast. So, and I don't know, I seem to make it even shorter by just packing it in. But so I would say, get after it. I heard Jerry Seinfeld speak at my kid's graduation. He said, everybody wants to find a passion. He said, well, passion is sweaty. Just find something you like a lot, because your passion may shift. So you can be passionate about something, but be open. I still don't really know what I want to do in healthcare. I just know I want to make significant positive impact in healthcare, and kind of why I've done different things. I'm like, well, that sounds great. That could be interesting. And again, I like the steep part of the curve. Maybe I want to be ahead of the curve, but I know I like the steep part of it. And so I'd say be open to learning. The world changes, problems evolve, solutions evolve. So I'd say be open-minded, get after it, take initiative, and take advantage of all the opportunities that we have here at Michigan.
Terrific. Let's give Amir a round of applause. And Amir, I want to thank you just for your time, your words of wisdom, your words of inspiration, for sharing your experiences that we all can draw lessons from. We will be making a recording of this event available online, and it'll be available in several places, including the School of Public Health website. So please do refer to that if you'd like to access it. And then I hope you can join us for our next episode of Ahead of the Curve, which will be held on January 16th. and it will be a virtual event, and it will feature Gina McCarthy, former administrator of the Environmental Protection Agency. And so thank you again to Amir and all of you for joining us, and all of you who joined us via live stream as well. And Amir, if you'll join me in saying go blue. 1, 2, 3, go blue.